Today I'm going to talk about three things: why remote patient monitoring is a critical part of telehealth, the challenges for startups to scale up using remote patient monitoring, and third, how these risks and challenges can be mitigated. Now, telehealth companies are aggressively trying to solve the problem of increasing their customer retention as well as compete for a market share of the $40 billion global telehealth market. Now, telehealth has been traditionally viewed as the platforms that enable video chat between doctors and patients, say, for example, Teladoc in the US. But nowadays, often telehealth is used as a more overarching term. For example, hospitals now enable video chat as a follow-up for clinical visits as well as post-operative care. Then there are these health insurance companies that enable video chat for their customers with their GPs to mitigate the costs. As a solution to the customer retention problem, as well as to increase their market share, telehealth leaders like Global Med or Iron Bow Healthcare Technologies have successfully integrated remote patient monitoring to their platforms. Now, remote patient monitoring can be thought about as wearable medical devices for biometric tracking that enable continuous monitoring of patients outside their usual clinical setting, say, for example, at their home. Large telehealth companies have CIOs and experienced teams that can either build their own or integrate privately labeled remote patient monitoring solution to their platforms. Now, startups and SMEs who also want to use remote patient monitoring as a critical piece of their growth often face a lot of regulatory as well as integration challenges. For example, if you are a personal genomics company in the Silicon Valley, or you are a cardiac care platform in New York, or you are a telepsychiatry platform in Eastern Europe, you would face a similar set of challenges to integrate remote patient monitoring at your growth stage. A startup or an SME at that stage would have three options. The first one would be to partner with a large company which makes remote patient monitoring devices, say, for example, Philips Healthcare. But if you are a startup, would you have the volume for their minimum order? The second option would be to procure consumer-grade wearable fitness devices like Fitbit or Apple Watch, and then build an API to integrate the data from these devices into your platform, which brings with itself its own regulatory challenges. Say, for example, there are regulatory challenges for EMR integration or HIPAA compliance for the cloud, and even correct labeling while repackaging the devices, such as CE marking. Or the third option would be to privately label a remote patient monitoring solution from an original device manufacturer. The distinct advantage of the third option is that a startup or an SME can integrate using a step-by-step process which allows them to tackle the challenges of integration one at a time. Now, with an example, I'll show how the same multi-step partnership process can be further used by the startup to generate sales as well as to raise further investments. In the first step, the startup can evaluate the accuracy as well as the user experience of the device with a single user and a single unit. Now, these are important factors to quantify, since the doctor who will recommend the device cares about its accuracy, and the patient who will be wearing the device for prolonged hours cares about the user experience. Now, this step can be summarized into a short report for your seed investors, as well as to gauge customer reactions. In the second step, the startup or SME can now test the integration of the remote patient monitoring solution to their platform with a handful number of units. Typically, at this stage, there are multiple beta users, as well as a caregiver or a physician. Now, the startup or the SME at this stage should also use extensive user experience surveys to identify the relevant KPIs to monitor the usage pattern of the device and the platform. This study can also be summed up as a white paper and can be used in your Series A funding. Now, this white paper can be again used for your social media campaigns to announce the partnership process to your prospective clients or your target audience and measure their reactions. The third step of the process is going for a pilot launch. This can be done with a select group of users in a specific geography. For example, if you are a telehealth company providing cardiac care in London, New York, or San Francisco, you could have a pilot launch for your patients only in London. By restricting the launch to a specific region, the startup or SME can measure the outcomes of the pilot launch by using the KPIs identified from the previous step, and then further use the KPIs to improve their sales, their integration, as well as support processes. Now let us look at the benefits of having a structured partnership process. The first and perhaps the most important advantage of the multi-step partnership process is that the startup or SME can use this multi-step process to identify the most relevant KPIs for their business. Some examples of KPIs for user interaction with the device could be average number of hours of usage per patient, or percentage increase in the number of patients per month, or the average number of times that a patient wears the device per day. Now, these KPIs can be turned into a real-time visual dashboard post the pilot launch to monitor the health of your business. The second benefit is that the process can be used to drive inbound sales by publishing the results from each step of the partnership process. For example, if you are a B2B company, the reports at the end of each phase could be turned into LinkedIn articles and then catered to your relevant audience. Or for example, if you are a B2C company, you could use the results from each step to drive social media campaigns in Facebook as well as Instagram. Coming to the third benefit, a multi-step structured partnership process helps your investors by mitigating the risks of integration, since a startup or SME would progress to the next step only when the previous step is successful. The step-by-step partnership process can be even used post-pilot launch to systematically scale up your remote patient monitoring business. Once such a structured partnership process have been imbibed into the DNA of your company, you can use it to add newer products or features to your platform every time. Coming to the end, now let us revise the three main takeaways from my presentation. The first, a step-by-step partnership process will not only help a telehealth startup to scale up, but also mitigate the risks of integration. Second, a step-by-step partnership process will help a remote patient monitoring or a telehealth startup to engage more with their customers or clients. And third, a step-by-step partnership process will help the startup to define the KPIs to monitor the health of their business.